Good morning and good afternoon, depending on your time zone. Welcome to this webinar, which is part of the Global Health Series for this year from the Socioeconomic School of Public Health, National University of Singapore. Today's topic is about smoking policies. So what can we learn from New Zealand and Malaysia smoking policies for future generations? What can we learn, I guess, in Singapore and the region and the area? I would like to introduce our moderator, who is Associate Professor Jeremy Lim. Jeremy is the director of LIGHT, who is the Leadership Institute for Global Health Transformation in the School of Public Health at National University of Singapore, and he will guide us through this webinar today. Over to you, Jeremy, for the introduction of the speakers. Thank you.
Thank you very much, Elisa, and a very good morning or good afternoon or good evening to all of you wherever in the world you may be. I am really delighted to be able to moderate today's session. For all of us as really public health professionals, we know that smoking has been one of the major, if not the major public health issue of really our time, next to equity, next to climate change. And despite knowing for more than half a century the harmful effects of smoking, today, still more than 1.1 billion people on this planet smoke, right? That's about 1 in 8 persons around the globe. And more than half of these persons are in Asia. And if we look at the numbers, they are staggering. 42% of males in China smoke, 65% of males in Indonesia smoke. And despite the best efforts of really global actors with the Framework Convention, the WHO has promulgated the Empower sets of standards, smoking remains a stubborn, almost pernicious challenge. And this has given rise to the notion that we should think about more radical solutions beyond technologies, and I'm sure during the discussion we'll talk about nicotine delivery systems like vaping and so on, but really beyond the really technologies, are there policy implementations that we can be bolder, right? And in a smoke-free generation proposal, it essentially argues that we should preclude sale of tobacco to individuals born after a certain year. And in Malaysia, as well as in New Zealand, this has been proposed. And the policy intent is really to overcome the limitations in current youth access laws. Right? Smoking is still seen as a rite of passage, and the fact that it is still legalized sends mixed signals to the younger generation. Right? And very compellingly, smoking, or the onset of smoking, is a young people's challenge. More than 80% of smokers start by age 18, and virtually every smoker would have started smoking by the age of 26. So if we can nip this in the bud, so to speak, can we truly have smoke-free populations. And if I take us now down to our webinar today, New Zealand and Malaysia have recently proposed to end tobacco use for future generations. For Malaysia, it's 2005, and for New Zealand, 2008. And we have today a very formidable panel to join us. Firstly, we have Professor Robert Bigelow, who is Professor Emeritus at the University of Auckland and chairs Action for Smoke-Free 2025. And Robert has spent many years in the World Health Organization, where he was the director of the Department of Chronic Disease and Health Promotion from 2004 to 2007. Next, we have Mr. Muhammad Syahani Abdullah, who is the Secretary General of the Malaysian Council on Tobacco Control and the Tobacco Control Coordinator of the Federation of Malaysia Consumer Associations. He's also the Chairperson of Sustainable Development Network Malaysia. And after these two gentlemen share what's happening in their respective countries and why, we are delighted to have Professor Chia Kee Seng, Professor and Founding Dean of the National University Singapore Socioeconomic School of Public Health. And Kee Seng is known to all of us in the public health world, and with very broad interests, a very thoughtful policy thinker, and really very keen to look at genetic, lifestyle, the so-called, in today's precision medicine world, a multi-omics approach to see how these interact to cause disease, and what then can we do to translate into upstream population measures. And finally, I'm delighted to introduce a very old friend, Professor Koon Heng Noon, whom I used to work with in the Singapore General Hospital and the National Cancer Center many years ago. In fact, it was during that time that Koon was making the news here in Singapore for proposing a smoke-free generation, right? And Koon was and is a visionary. Back in those days, I recall the heated debates, pardon the pun, and it was ultimately not supported by the government. But in light of recent policy really perspectives coming out from some of our own fellow Asian countries, perhaps this is time to look at again, right? And I think Koon was undeterred and founded the Tobacco-Free Generation social movement. And after that, in 2015, guided the formation of the world's first tobacco-free generation legislation, which can be found online. And we'll put the link into the comments later. So without further ado, I'm delighted to kick off with the presentations. And Robert, over to you. Thank you very much.
Well, good morning, and thank you very much, Professor Lim, for that introduction. I'd like to especially appreciate the work of the organizers in setting up this webinar. It is, as you mentioned, Professor Lim, an extremely important issue. And the discussion of bold initiatives is absolutely appropriate at this time. I would like to speak really on two issues. One is the progress that we've made in New Zealand towards the smoke-free 2025 goal, and then the more recent discussion about a smoke-free generation proposal. And like you, I'd like to acknowledge Professor Koon's initiation of this discussion so many years ago. I've got 6 slides, a couple of topics, and I want to emphasize at the beginning, and I'll come back to this, that context in tobacco control is everything. And what we might be discussing in New Zealand is based on our history, our particular circumstances, our patterns of smoking. So context is important. As you mentioned, Professor Lim, I've been involved in tobacco control for a long time, and perhaps 1982 is a significant point in my journey. That's when I started ASH, Action for Smoking and Health, which, as you say, is now called Action for Smoke-Free 2025. And I chair the board. I also want to make it very, very clear that I have no other conflicts of interest except my passionate involvement in this issue from a public health perspective. I am an epidemiologist, a public health physician, long-standing engagement in the prevention and control of chronic diseases in New Zealand and the Pacific and indeed globally. And I think it's just worth mentioning that as I think about how come I've been involved so long and why haven't I moved on to other things, for me, cigarette smoking has enormous personal connections. My father, born in 1906, my mother, born in 1910, my aunts and uncles, and indeed brothers, a brother and brother-in-law, have all suffered from the consequences of a lifetime of smoking. So this is not only for me a public health issue, but a personal issue. And I think that that energy drives us all, the combination of the personal and the political and the public health. So if I could just move to the next slide. Thank you, Dominique. And this, I do admit, is a very complex slide. And it takes us back to 1984, when there was the first, or 1983, the first government tobacco control program began. Yeah, thanks for highlighting that. And over the last 40 years, there's been a steady implementation of a whole variety of tobacco control policies. I just want to highlight perhaps the Smoke-Free Environments Act in 1989, which was a world-leading act. And then beginning in 2010, the first of 11 10% increases in taxation. And in 2021, there was the legislation on smoke-free cars, 2020 actually, and vaping products have been regulated. And last year, the government released its proposed smoke-free action plan. The goal of this plan is to reduce cigarette smoking, daily cigarette smoking rates down to less than 5%, such that when the goal is achieved, 95% of the adult population will be smoke-free. Until now, there has been almost no discussion of banning smoking. It's all about implementing Framework Convention on Tobacco Control and the Empower package of interventions. And I should say that New Zealand has done very, very well in that regard. And we have carried out all of the recommendations to the highest level. And as you can see in the blue line, this is current smoking, has continued to decline, perhaps especially in the last 10 or so years. I actually prefer daily smoking, and the daily adult smoking rate is now down to 9.6%. And of course, you mentioned, Jeremy, the issue of equity in your introductory remarks. Unfortunately, smoking in New Zealand, cigarette smoking, is a marker of poverty. So although the overall adult daily rate is under 10%, it varies enormously by socioeconomic standards, and of course also by ethnicity, which is tied up with socioeconomic issues. So I think this is true in many of the more affluent countries in the world. Smoking is increasingly a marker of social disadvantage. But overall, there's been some tremendous successes in New Zealand and adults. Also of interest is the red line, which is the regular smoking rate in what we call year 10 students. These are 14 and 15-year-old school children. And you can see that the rate has declined from in the high 20s at the turn of this century. But I would point out that now daily cigarette smoking in young people is down to 1.3%, lower than shown here, of course, for regular smoking, which includes anyone who's had a cigarette over the last month or so, not such a useful measure of tobacco use. So a lot of material on that slide, not too worried about the details, except to say that New Zealand has been active for a long time in this field, and we have had some successes. We still have a way to go before we reach the smoke-free 2025 goal, which was first adopted by the then government in 2011. So that's the New Zealand context. If I could have Dominique, please, the next slide. So I'm focusing now on youth smoking, and I want us to be clear about what the problem is. And as I looked at data from the WHO, CDC, Global Youth Tobacco Survey, I think it's called, for countries in the region, there is very little up-to-date information. And the Global Youth Tobacco Survey data on current cigarette smoking is shown here. Indonesia, 2014, males 22%, females 1%, as you mentioned, Jeremy. Malaysia, 2009, male 31%, much lower in females. China in 2013, 10 and 2%. Singapore, 4%. I don't have that differentiated by sex in 2016. And I understand that there is another youth cigarette smoking survey underway this year in Singapore. And there in New Zealand is our daily cigarette smoking rate. The rest have been current. Our daily rate, 1.3% in boys and girls, which we consider to be a tremendous success. Of course, there still is inequalities, both in terms of school background and ethnicity, but in every ethnic group, in every school district, the rates are coming down. I'm not sure that they would ever get lower than 1%, but who knows? My point about here, and I do apologize in a way that I have extracted these data from the Global Youth Tobacco Survey. For all I know, there might be much more recent data from the countries that I've highlighted here. My bottom line here is that we need to be clear about what the youth smoking problem is. More data is required, in my view, to inform policy, not only on cigarette smoking rates, but reasons why young people are smoking. And importantly, from the smoke-free generation idea, where do they get their cigarettes from? In New Zealand, for example, most young people get their cigarettes from friends, older friends, relatives. They don't, on the whole, buy them from shops. So there's quite a lot of information we need about youth smoking behaviors, habits, and patterns in order that we frame policy in the most effective way. And please, in discussion, give me more recent up-to-date information for these countries and other countries if you have it available. Dominique, next one, please. And this is the decline in daily smoking in green from 15% in 1999, now down to 1.3%, and a steady decline. And I mentioned that there are social patterns, and in New Zealand, youth smoking follows adult smoking. So if adults in a region, area smoke, in a suburb smoke, youth will smoke. Parental adult smoking is an important influence, as you know, on youth smoking. The red line is extremely interesting. And you'll see that in 2015, daily vaping, the use of e-cigarettes, was very uncommon. But over the last couple of years, it has become increasingly common. And there is a lot of concern about this in New Zealand policy, parental, school circles. And experimental vaping is even more frequent than the 9.5% shown here. You will be interested to note that even though the daily vaping rate has increased substantially from 2019, and we didn't do an ASH survey in 2020 because of COVID, that the youth smoking rate has continued to decline slowly. So as a parenthetical statement, I would say that at this point in time, there's no evidence that the increase in daily vaping has been associated with an increase in daily smoking. That is, in New Zealand, indeed, as elsewhere, vaping is not a gateway to smoking. However, I know that's not the main point of this discussion, but since we have such beautiful data, I thought I'd share that with you. And these smoking and vaping rates have been produced almost annually by ASH with external funding. And the next slide, please. So the government's Smoke-Free 2025 plan, which was proposed last year after a draft had been circulated, extensive consultation over the space of about a year, is to propose ways of achieving the 95% smoke-free goal for adults by 2025. And there are a lot of aspects of this proposed plan, which I won't go into, but an overriding concern is questions of equality, inequalities. There's a lot of concern to make sure that all segments of the population are heavily involved in the discussion, implementation of the plan, and that leadership comes particularly strongly from Maori community, Indigenous people. There are three main aspects of the proposal: to reduce access to cigarettes, and there's a proposed dramatic reduction in sales outlets beginning in 2025. The proposal is to reduce the number of sales outlets in New Zealand from about 10,000 down to 500, thereabouts, not being specified exactly yet. There is a desire to reduce the appeal of cigarettes, and the main and the most contentious and the most interesting proposal is to introduce very low nicotine cigarettes beginning in 2025 as the sole legally available form of cigarettes. And then there's the promotion of a smoke-free generation, which would begin in 2027 and would mean that anyone born after 2009 would not legally be able to buy cigarettes. At the present time, young people under the age of 18 are not legally able to buy cigarettes. So starting in 2027, the proposal is that from 2009, anyone born after that date would not be able to buy. So the legal age of buying cigarettes would go up 1 year at a time. As an aside, I would say that the success of all of these policies depends still on reducing the demand for cigarettes and controlling the illicit trade in cigarettes. And I think that would be true throughout the region. It has been estimated that up to 10% of the cigarette trade in New Zealand is illegal, although that may be an upper estimate, and we need more information on that. And if I come to the next slide and the last slide, this is about a smoke-free generation, ? And the proposal is, as I have said, by 2027, prohibit the sale of cigarettes to individuals born after 2009. That date has still to be specified. And I should say that this proposed smoke-free plan, we're expected to see it in legislation later this year, and I understand the government would like to see it passed this year. I think a very strong positive aspect of the smoke-free generation proposal is it signals a very strong political will to protect young people from cigarette smoking and from the tobacco industry. From the New Zealand point of view, I think it's fair to say that there are some issues that require further discussion. The first point is that, in a way, the smoke-free generation has already been achieved in New Zealand, 1.3% daily smoking rate. How much lower do you want it to go? How much lower can it go? Remains to be seen. And I think this is, I mentioned also this before, cigarette smoking in youth follows adult smoking. And I want to emphasize this point, that it's based on parental influences. Youth smoking is based on parental influences on what adults do. And when adults stop smoking, children stop smoking. The third point there is that the smoke-free generation proposal will have no impact on the 2025 goal, because it doesn't come into effect until after the goal time has been achieved. Discriminates on the basis of age. You can say rightly that we do that at the present time. No one under the age of 18 in New Zealand can buy cigarettes. However, if this legislation comes to pass, if you were born in 2008, you would be able to continue to buy cigarettes. If you were born in 2009, you wouldn't be able to buy cigarettes. Interesting. It could be regarded as being an illiberal measure and as a de facto prohibition. And I guess one thing for us to consider, I think we would all agree in all of our countries, the major public health challenge in this area is adult smoking. Adults who continue to smoke after the age of 35 or 40 are at increased risk of death and disease from cigarette smoking. That is the challenge to reduce adult smoking rates, in my view. So I would say that, in conclusion, it's a complex policy proposal, context dependent, requires considerable discussion. And I think the discussion needs to focus, perhaps even today or in future, is it a priority issue, policy issue? Even more importantly, Is it a necessary policy if it focuses on adult smoking? Will it work? And smoke-free generation, fine. What we actually want is all generations to be smoke-free, particularly the adult generations who are at greatest risk of tobacco-caused diseases. Thank you very much.
Thank you very much, Robert. And I can see the questions flowing fast and furious. May I please ask members of the audience to keep the questions flowing? And certainly this is a very complex, context-specific challenge. And the whole point of us in global health organizing these sorts of webinars are to learn from each other, because the context may be different, the politics may be different, but the objectives of all of us as public health actors are very, very similar, to allow populations, and here, Robert, I hear you loud and clear, it's about all generations having the ability to live long, productive lives. And on this note, can I turn the spotlight to Malaysia? And Mr. Shayani, over to you. Thank you very much.
Thank you, Professor. I'll share the slides. Okay. So in Malaysia, the concept is called generational endgame for tobacco products. So I'm Muhammad Shani bin Abdullah. So I'm involved in consumer advocacy since 1996, since becoming leader of a local consumer group. And one of the initiatives among in the consumer advocacy is tobacco control. And of course, before the FCTC, it was known as anti-smoking activities. And currently, I'm the Secretary General for Malaysian Council for Tobacco Control. So again, personally, my family, there were no smokers. Unfortunately, later, two of my sons started smoking. Even though my neighborhood has no smokers, but the peer influence in the schools actually get the children hooked up. I mean, not to say initiate smoking. So that is actually the main threat or challenge in Malaysia: peer pressure, and also the living condition of the major segment of the population, which actually has a high prevalence of smoking among the low-income group. Okay, so to introduce about the tobacco control in Malaysia. So smoking denormalization already started in 1950 as a law in the school registration ordinance, which says smokers are not allowed to smoke except the staff room. Of course, because of the conditions, so they are allowed to smoke in the staff room only. And then in 1996, we had the warning stated on the all cigarette packages that smoking is harmful to health. And within the education sector, there are many circulars only targeting the students. I didn't come across anything on the teachers beyond the 1950 ordinance. Of course, adults are actually regulated via regulation, tobacco control product regulation 1993. So I'm highlighting the provisions targeting the minors or the children. So under the 1994 amendment, it was included provision on sale to minors. Of course, there are smoke-free areas or areas where smoking is banned, public areas. Then in 1995, there was actually Islamic edict says smoking is prohibited under the Islamic edict. So it is the only guidance to Muslims. It's not an enforceable regulation. And later in '97, the regulation was amended to include ban all adolescents below 18 from smoking, chewing, or possessing tobacco products, and also included the educational institutions. And Malaysia signed up to FCTC in 2003, and as an obligation under the FCTC, the regulation was amended and reintroduced as the Tobacco Control of Tobacco Products Regulation 2004, and the FCTC came into the regulation came into force in 2004, and currently the same regulation is in force. It's under the Food Act 1984, and of course, as obligation under the FCTC, this regulation was amended numerous times to increase the smoke-free areas. Later into, under this new regulation, of course, the education institutions were maintained, and until 2020, the areas where smoking is banned. So the last one was the elimination of the air-conditioned eating places. Previously, it was only banned in air-conditioned eating places, but in 2020, it was amended to include all eateries and restaurants, even though in outdoors where food is served, it is considered an eating place, and smoking is banned. And under the regulation, these are the penalties: fine of 10,000 ringgit or imprisonment of 2 years, not exceeding 2 years. And also the compliance to smoking ban is also the responsibility of the premise owner. So if the regulation is not complied, the owner is liable for a fine of 3,000 ringgit or imprisonment of not exceeding 6 months. Okay, and beside the tobacco control regulation, there are also other legal provisions which tackle tobacco. Under the Malaysian Communication and Multimedia Content Code, all service providers, meaning TV, radio, and internet service providers, are to comply with the tobacco control regulation, meaning there is a ban on advertisement or depiction of any smoking. So all media organizations are to comply with this tobacco control regulation. And under the censorship board, there are also provisions to ban no scenes of children smoking. And there are also provisions under the Occupational Safety and Health Act, where there is actually an industry code, which also refers to exposure to environmental tobacco smoke. And under the code, there is actually a provision which refers to the tobacco control product regulation, the 3.8.1, and other areas which are not referred under the tobacco products regulation. The workplaces are under the 3.8.2, but however, this provision is not enforced as a mandatory provision. It's quoted as a voluntary code. So this is a challenge. Not all workplaces are banned of smoking. And there is one more, actually. There was actually a national tobacco board to handle the cultivation of tobacco. And in 2010, as a compliance to FCTC, to divest the tobacco farmers into other crops, the act was amended from National Tobacco Board to National Knaf and Tobacco Board, 2010 as the act. And Knaf has the alternate crop for the tobacco farmers. And under the act, there was also a regulation passed in 2011, National Knaf and Tobacco Board regulations, which authorizes the board to license all activities related to tobacco, including retail sale of tobacco products. However, until today, this regulation has not been implemented due to the lobby of the industry, of the tobacco industry. So again, I mean, sad to say, I mean, under the act, there is actually a tobacco industry representative in the board. Okay, so because this actually will be related to how do we regulate the tobacco products. So currently there is no regulation on the sale of tobacco products. But the board has actually informed us that currently in 2022, they are registering all the retailers who are selling tobacco products. And in 2023, the licensing will be implemented. Okay. To share the smoking prevalence in Malaysia. So these are the data through the National Health and Mobility Survey, and in 2015 is the Global Adult Tobacco Survey. And we can see the prevalence is almost stagnant. And it's the smoking prevalence among adolescent. Again, the blue line is the male, and the gray line is the female. And I'm sorry, the blue line is the overall figure, and the reddish line is the male. So it's relatively high percentage of prevalence among the adolescent. And exposure to secondhand smoke is under the National Health and Mobility Survey. The males are 42.7%, female 1.1%, in workplace 27%, homes 31%. The children's are 2/3 are exposed to secondhand smoke, and in eateries 9%. So I like to share this, as the Prof mentioned, that the adult smoking affects the others, including the children. So this situation influences the incidence of smoking among children. Okay, and I mean we only see that secondhand smoking as a exposure to active smoking. But if we refer to the smoke in the lungs of the smokers, it takes 8 hours to completely or sort of effectively clear from the lungs. So meaning even after active smoking, the smokers are actually exhaling smoke in no smoking areas, meaning within workplaces, within homes, within vehicles. So these two are giving the same impact, you know, as smoking, and especially to smoking parents. The children are, defined as clinically addicted to nicotine. So, meaning if these children are encouraged by the peers to smoke, they have no challenge, or they don't feel any irritation to smoke, and they easily take up smoking. So, and we also, often this information is not shared. No, I also see that in certain companies in Japan, the smokers are not allowed to come back into the indoors or into the office immediately after smoking. They are only allowed to enter the premises after 45 after their active smoking. So meaning there is some recognition that this second-hand smoke by smokers also need to be highlighted, so that the non-smokers are protected from exposure to tobacco smoke. Okay, and I would like to share this graph from a paper published, and thank you, Dr. Kun, for sharing this in the Tobacco-Free Generation website. And we can see that the estimations, predictions based on cessation, smoking cessation rates and initiation rates gives us a very clear picture that not in near future, with the current rate of smoking cessation and initiation rate, we can achieve our end game. So even though I would say, sorry, okay, maybe my sequence a bit. Okay, so this actually, this information is very important in planning and implementing our policies, so that the targets are actually realistic. The next is actually the tobacco control interference. So, as WHO has also published that many of the industry documents also says that they are targeting the youth via various means, social media and all that. So these are the strategies employed by the industry to promote their products. So the products are appealing, even they look like very innovative gadgets, and the parents even do not actually realize these are actually smoking devices. So and again, messaging and also industry using the media to undermine the tobacco control activities. So this is under the National Strategic Plan for Tobacco Control. So our target of achieving less than 5% is 2040. The proposed tobacco control bill, and we do not know the actual title of the bill, but I just put it there as a tobacco control bill, which was announced by the government, will be introduced in the parliament in July, and it includes generational endgame for tobacco products, smoking products. Means all born on or after 1st of January 2005 are prohibited from buying, selling, smoking, or possessing any smoking product. So that is the information we were actually given by the Ministry of Health, but we do not have the details as of in New Zealand, even though it is 2000. I mean, it will be implemented only in 2017. Here it is already states 1st January 2005, meaning those are actually currently 17 years old. So if it is implemented, meaning all those who are now below 18 will progressively affected, and meaning immediately the provision to ban those actually under 18 will take effect immediately, meaning next year those actually born 2005 will be 18, will not be actually allowed to buy, sell, smoke, or possess smoking products. So here the definition of smoking products includes vape and e-cigarettes. And generation endgame currently facing opposition from the tobacco and vape industries. So they are, even though the provision only targets the minor who are not smoking, their argument is that we are actually preventing freedom of choice. Secondly, denying choice for harm reduction, meaning so the smokers have no choice to use less harmful products such as vape and e-cigarette, even though the children are not supposed to smoke under the current regulation. Loss of government revenue. Children are not actually buying these cigarettes, but they quote as loss of revenue to the government, and also they state that it will be a challenge to enforce this regulation. And loss of revenue, again, government has not increased the tax for past 6 years, since 2015, on cigarettes, tobacco products. So again, they are not highlighting that government has not increased the tax for past 6 years, but they are actually using that argument that by implementing tobacco, generation endgame, government will lose government revenue. For me, the tobacco industry interference is the major obstacle in implementing many of the tobacco control measures in Malaysia. And second is actually weak community participation in tobacco control. The minister has announced all of a government and whole of a society approach, but it requires meaningful participation from the communities. Currently, often programs are organized by government agencies where the communities are only participants, and so there is a lack of feeling of belonging in the programs conducted. So, I mean, that's my presentation. Thank you.
Thank you very much, Mr. Shayani. We are a little behind schedule. So I would ask Kiseng and Kung to keep their comments to 5 minutes. And maybe let's start with Kiseng. Could you start reflecting on what the two speakers have shared and perhaps frame this in the wider context of all the Asian countries? And what are some of the implications and what are some of the more universal lessons that may be applicable to many countries? Kiseng, over to you.
Right. Thank you very much. Thanks, Robert and Muhammad, for sharing the New Zealand and Malaysian initiatives. Perhaps I would like to frame my response in the form of two questions. First question would be, will the tobacco-free generation approach work? And I think both speakers have highlighted that smoking is a very complex, wicked problem. And that means that we need multiple approaches. We have to recognize that no single magic bullet or silver bullet can solve the smoking problem. And so most jurisdictions would have started with harm restriction policies. Things like taxation, stipulating where you can't smoke, to where you can smoke. And then from the harm restriction policies, move on perhaps to a harm removal policy. I see the tobacco-free generation actually as a very targeted harm removal policy. That's why it is kind of highlighted as an endgame strategy. My personal view is that tobacco-free generation will work, but it must be used together with other policies. It cannot be seen as the magic bullet or the silver bullet. So I think in whether is it in Singapore or the region, we mustn't get distracted with the idea that look, we have a single policy instrument that will work or will be more successful than other policies. It must work hand in hand with other policies. Then, specifically in Singapore, should we adopt the tobacco-free generation approach in Singapore? When I was born in the 50s, smoking was very common. We have no data in terms of survey, but I think more than 50% of the population, male population, I always like to separate in Singapore context, male smoking prevalence and female smoking prevalence because they're so different. Among males, probably during that time, 50% of males were smokers. So the strategy was to denormalize smoking and take a harm restriction kind of policy measures. And over the decades, like in the case of New Zealand, we've been very successful. In the last decade, our prevalence among male smokers was from around 20 to 25%. It has gone down slightly to about 18% in the latest survey. But the impact of our denormalization strategy can be seen in our lung cancer incidence. It was 60 per 100,000 as its peak in the 70s. Now it has halved to about 30 per 100,000 in terms of male lung cancer incidence. And then over the last decade, we had several measures whereby we targeted the young, trying to prevent the young from picking up smoking. So we banned e-cigarettes, we banned shisha before they took root. We introduced plain packaging. and we raised the minimum legal age to 21. I was hoping that they will continue to raise the minimum legal age, and because that would then effectively be a tobacco-free generation for those born in the year 2000, right? Perhaps it's now time for us to modify the minimum legal age legislation to introduce the tobacco-free generation for those who are born in the year 2000, right? Because we are already, in a sense, one foot in the door, right? But it must be done with additional measures, the current measures as well as additional measures, like, say, for example, banning of flavored cigarettes. So my main takeaway message is that harm restriction and harm removal measures must work hand in hand. Tobacco-free generation will work together, with other control measures, to be successful. Thank you.
Yeah, thank you very much, Kising. And thank you also for the framework of harm removal, harm restriction. And I noticed that Mr. Shani used the term harm reduction. And some of the questions that we'll go into around the e-cigarette, nicotine versus tobacco, we will tackle in the Q&A. Can I hand the time to Kung? Kung, over to you, please. Yeah, Kung, you are still on mute.
Yeah, thanks for the opportunity to comment. The perspectives shared by Professor Bigelow as well as Mr. Shani are well acknowledged. I think what I hope to share, I think, is that one needs to see beyond just policy implementation. If you can internet search the tobacco-free generation website, which I was hoping to share, but I somehow have some technical challenge here right now, is that if you see from the website, you would have a wealth of information ranging from the menu page, where on the leftmost, it is more the policy issues, what is the definition of endgame, how tobacco-free generation qualifies for a endgame in ending the social, the political, as well as the structural conundrums that have been holding us back from overcoming the tobacco pandemic for the past 5 decades. In the middle portion, where it says overcoming global blind spots, you will see the 15-minute video presentation I made at the World Conference, highlighting the benefit of tobacco-free generation in overcoming all the current global blind spots that have been holding us back. And perhaps the most important item that I want to highlight here is that we forget that in policy making, we need to garner massive public support. And to get massive public support, we need to have material that resonates with our constituents, our citizens, especially the youth. So on the youth and adult advocacy tab, as well as the key progress, you would see how the tobacco-free generation movement, the social movement, as well as the design of how we have done it, engages the ground people in a very deep and meaningful way through powerful videos in an educational perspective. And by mobilizing your entire community to understand the deeper elements of TFG, you will have massive support that will make it easier for policymakers to implement the tobacco-free generation legislation. The legislation is more of a way for society to affirm our entire mental framing against the industry that has been harming us for decades. It is for us to acknowledge that this is a better way of introducing a new policy that's better for the new generation, and yet not continue penalizing the smokers who have been inadvertently addicted from earlier policies that were sort of underperforming. So I would keep it short for now, explore the Tobacco-Free Generation website so that you start to see, in order to implement Tobacco-Free Generation, you need to get massive support. And through our work there, you have seen how in Philippines, we have obtained massive medical public support. This is in contrast to in Tasmania. Tasmania attempted Tobacco-Free Generation in 2015, 2014, raising it in Parliament very quickly. And unfortunately, I think there wasn't a massive youth support, young adult support, and public support awareness of it, unlike what happened in Philippines. So if we start seeing that if we want to make policies that impact the new generation, we need to start engaging them. And in fact, they will be the situation, it will be a situation where they do not even want to experiment with vaping or smoking anymore, whereby there will be no demand. And if there's no demand, we are no longer needing to fight the industry, and it will just wither away. So thank you for the opportunity, Professor Jeremy Lim. Thank you.
Yeah, thank you, Kung. Yes, and if I can summarize the two key take-home messages from Kee Seng as well as Kung. Firstly, that the tobacco-free generation concept is a powerful tool, but it's really one tool out of a more complex toolkit that we have to deploy in a holistic manner, right? And this ties to Robert's point that it's really adult smoking that is a key challenge that is not addressed by the tobacco-free generation. Kung very eloquently spoke about the need to galvanize the ground and have massive public support for these interventions to clear the political hurdles and subsequently go on to really reduce demand. Because if there is no demand, then the problem will solve itself. I want to move all of you gentlemen into the Q&A sessions. And in the interest of time, I'm going to cluster some of the many questions we have. And I wanted to tackle first perhaps some of the operational questions. And we have a question from the Ministry of Health here in Singapore, which asks about the pragmatic implementation that is planned in New Zealand as well as in Malaysia, specifically around enforcement. Is the intent to introduce penalties for retailers, for the youths who are in breach of both? What then do we do with tourists and short-term visitors? Would foreigners come under the Tobacco-Free Generation Act? And one point, I guess, that for those of us here in Singapore, we would have heard this many times. Low crime doesn't mean no crime. And even with a tobacco-free generation, there will be individuals, perhaps a small proportion, that will still commence smoking. And what then happens to this group? Will they be, and in quotes, will they be forever criminalized? Maybe can I hear from Robert first and then Mr. Shani?
Well, thank you. Critical questions. And at this stage, we do not have the draft legislation. None of these issues are being discussed publicly, but I think it does highlight the difficulty. I would expect that in New Zealand, the criminalization would be of the sellers, the suppliers, not the individuals smoking. I think the legislation would also apply to tourists. One problem we're going to have in New Zealand is that we don't carry an ID. So there's no way that anyone can determine what your age is. The most common form of ID is a driver's license. But, a lot of young people are not going that route now. So there are some practical difficulties that have yet to be resolved. And make me consider always the practicalities of this lead proposal. I completely agree with the need for multiple approaches and the need for community support, irrespective of the tobacco policy. Excellent points.
Thank you, Robert. And I think COVID has richly demonstrated to us implementation is policy, and policies that are made in ivory towers that cannot be effectively implemented may actually ironically set us back. And maybe over to you, on the situation in Malaysia, Mr. Shani.
Okay, thank you, Dr. Jeremy. Okay, my answer will be quite similar to Prof.
Yes.
And the text of draft of the bill is not out, so we are not aware of the details. Of course, the enforcement should be multi-pronged, and it's again often when we talk about law, we often think of enforcement. Law is the lowest level of ethics, so meaning everyone should be promoting and complying to any laws and regulations. And it's actually a whole of a society's effort. Yeah, thank you.
Thank you. So we wait with bated breath for the details, and I'm mindful that, for example, in the Philippines, there will be an act passed, and then there will be the implementing rules and regulations that will follow. And I guess a similar situation here, that both governments have announced this, so there is clearly political intent, and now we have to await the details. Kung, would you like to comment on this?
Yes, thank you very much, Jeremy. If you go to the website again, under Overcoming Global Policies, Global Blind Spots, the drop-down menu will have a video that will entertain you a little bit on how implementation tobacco-free generation is so much easier at the point of sales, because you're just looking at the birth year number and no longer needing to calculate age. So enjoy the video. That will be how point of sales implementation will be on the ground. Simpler, easier, and faster. Thank you.
Thank you, Kung. Can I move to the next question? And this is, I guess, a difficult, perhaps somewhat technical question. And I know that Malaysia and New Zealand have taken slightly different approaches. There are a number of questions in the chat around the use of vaping and really e-cigarettes, and question, should these be banned for future generations also? And I guess fundamentally the question that we're trying to ask is, are we trying to be nicotine free? Are we trying to be tobacco free? And Mr. Shani, I do note in your slides that you have not used either nicotine or tobacco, you have used the word smoke. And maybe views from our esteemed panelists, and Ki Seng Kung, please do feel free to chime in.
Okay, for the new bill, what we understand when we actually recommended that it should include e-cigarette and vape,
yes.
the response was that, so the terminology will be used will be smoking products, to include any which may be not even maybe in use, to be included in the definition, so that the law can be effective. Yeah.
Thank you. And maybe over to you, Robert, any views?
Well, the New Zealand government has taken quite a different policy, and it recognises already in the vaping legislation, which was passed a couple of years ago, that the harm caused by cigarette smoking comes from the smoke, as we know. And in effect, the nicotine, although it can produce dependence, is not causing death and disease. So the government recognises that alternative sources of nicotine are much more desirable than smoking cigarettes. And the plan is and they are available, regulated, and quality controlled, and the government is promoting them as a much less harmful alternative than cigarettes. vaping is not allowed to be, vapes are not allowed to be sold to young people under the age of 18, same as cigarettes. So we have a different policy altogether.
And maybe Robert, if I can ask you a little more on this, do you see vaping as an option for really adult smokers? Because you had mentioned in your presentation that the elephant that's in the room is really the adult smokers, and what do we do with them?
Yes, absolutely. So we do not encourage non-smokers to vape. We do not encourage young people to vape. We certainly encourage adult smokers to make the transition through however they can to less harmful products. And then ultimately, if that works for them, to be nicotine free as well. But the most pressing problem is to support adults to stop smoking cigarettes through the use of less harmful products.
Thank you, Robert. And that somewhat ironically, and perhaps maybe even a little perverse, is this reverse gateway where, Robert, if I read you right, is a shift from cigarette smoke to nicotine alternative vapes, heated tobacco, and then for the specific individuals then to move to become nicotine free, right? And we'll talk about the gateway effect later. But Kung, you wanted to say something, and perhaps Kising, can I ask you also to opine on this, because Singapore has taken a particularly absolute stand. So vaping products, heated tobacco, and so on, they are completely banned. Kung, over to you first.
Thanks. I think Singapore, thank you very much, Jeremy. So Singapore has banned vaping from 2008. And if you read the recent public domain information article, Straits Times Zaihan, about 2-3 years ago, vaping sparks worry. It's just no way that the entire legislative process can control this, can enforce, because it is a smokeless product. They can import directly, and there is no way schools can actually even track the data. So we need to move away from thinking that we can control this. And the only way we can get there is to have better education for our younger generation. And there is strong data to suggest that if you bring up the industry, rather than just continuing to be struggling on whether debating vaping versus smoking, I think if you bring up the industry, California as well as Florida data on Truth Campaign has showed that it is more effective. And that's why in Tobacco-Free Generation, we do a combination to be against both vaping and smoking. Once there is no demand again, there is no more industry to worry about. Thank you.
Thank you, Kung. So the tobacco-free generation is really both a tobacco-free as well as a nicotine-free. But at the same time, you also recognize, if I take you to Robert's earlier point around vaping as an option for the adult smokers, and you rightly pointed out that the devices are so small, compact, they're smokeless, that the enforcement becomes very difficult. Maybe over to you, Kising.
Yeah, so I agree with Kung that one of the big piece that we need to work on is, of course, education. And education along the line of not just not picking up smoking, but being addiction free, right? So I think that's the broader piece that is needed. And I agree, Robert, that you should not encourage non-smokers to vape. You should not encourage the young to vape, right? And if that's and I agree that there will be the implementation issues. One key point, I think, when you set a policy is also the overall messaging that you're getting across. Right? So you may have implementation difficulties, but the policy that you set is actually the direction that you want to move. Yeah, you want to move the entire country towards. Yes, I agree that you shouldn't have a policy implementation divide, but one of the key advantage of having a policy is to recognize that, look, this is what we are pursuing after. It's almost like a vision. right?
Yes.
And the vision is actually to be addiction free, right?
Yeah.
So I agree that there's hell of a lot of implementation issues when it comes to vaping.
Yep.
Uh, I see lots of people in the public, secretly vaping and so on and so forth. And you can get vaping products easily in Singapore, in spite of the ban.
Yeah.
So
No,
if we are to allow vaping, I would say, look, vaping should not be a consumer product.
Okay. Yeah,
It
should be a prescription
something for
product.
smokers, like a
Okay.
prescription product for smokers to help them to quit. I think that's great.
Okay.
And I think the messaging will be very different if I allow vaping as a consumer product versus vaping as a smoking cessation aid.
Yes. Okay. Thanks. I am actually dialing in from Thailand, and I remember before COVID, I was taking a class of Thai medical students, and this topic of vaping came up. And very interestingly, I think Thailand also has a similar policy stance to Singapore. But during the break, a number of students came up to me, smiled shyly, and opened their hand, and I said, "Oh, okay, right." And I got this. Okay boomer sentiment that, oh, you old people don't understand how easy it is, and it was at that time that I fully recognized just how germane and how pertinent it is to look at measures to avoid addiction, particularly in the young, because they are a vulnerable group, right? I want to move a little and still sticking to smoke-free generation. Or really tobacco-free generation, I want to circle back to Singapore. And Kung, you made a comment in the chat around the policy headwinds. And can I ask you to reflect from the time that you tried a decade ago to now? Are you more optimistic, and if so, why?
Yes, thanks, Jeremy. That's a very powerful question. I think from we started 10 years ago to now, you're getting increasingly number of academias who are beginning to understand the concept and starting to talk about it. If you watch other webinars, ASH USA, they are also conducting a lot more TFG webinars on it to try to get the global narrative going in that correct direction. And from past tobacco control policies, the more people talk about it, the more it is likely to be implemented. As what Kissing has said, it is about getting people to talk about it, and then it will get the global movement going. So it's very optimistic. I'm very pleased that New Zealand has actually really started the ball rolling. Credit, I think, goes to Richard Edwards and George Thompson Group, because they were the first few people who heard TFG back in 2012 when I presented it in Singapore. And similarly for Brookline, they also heard it probably from the US attendees who came back when we first introduced TFG. So I think what you're seeing is this gradual permeation of TFG awareness across the world. And the more countries pick it up and get the narrative going, the more we are able to deter the tobacco industry from coming on board. So I think, yes, thank you for the question. I'm very pleased. Remember that this is going to be, I think it will work. Yeah, thank you.
Yeah, thanks. And maybe Kissing, can you chime in with your views? You're a veteran public health leader, and you're close to the policymakers. Are you optimistic?
Yeah, I think I'm optimistic that we have already kind of started moving in terms of minimum legal age, and that, in a sense, I think is a small step towards this tobacco-free kind of generation. But I just want to also highlight what Kun has mentioned, that it has to be a social movement. It is not just a legislative kind of exercise. And we actually have the advantage of, the newer generations, whether you call them millennials and downwards or whatever, generation you call. They have very different mindset and value systems from old cronies like me. Right? And
he's saying, I think where many of us on this are in the same description, so sympathies.
And I think they have the potential of developing a different set of value systems than what we have gone through, right? Potentially that they value things like health, they value things like well-being, rather than the pursuit of wealth at the expense of everything, right?
Okay. Yeah.
And if we can get the message across that, look, by not being addicted, you are actually demonstrating that new value system. Yeah. Then I think it can be a very powerful kind of social movement. Yeah.
All right.
And and in legislations is always behind the curve. Let's put it that way, right?
Yep. Okay.
Jeremy, can I just chime in
yes,
here?
please.
Just 30 seconds.
Okay.
What Kiseng has said is very powerful because I think the young people represents the new power. All right. There's a beautiful article in Harvard Business Review, Old Power and New Power. New power flows like energy. It just flows across, and that's where the young people come in. But let's not forget that we have a role too, because we as academians, as policymakers, have the network and has the structure for us to harness their ability to put together. So our roles are still very important because the young people have the energy, but they don't have the sustainability. So it is marrying both qualities that we will be able to overcome this 5-decade-old pandemic that is killing all of us. Yeah, thank you.
Okay. Thanks, Koon. And we are running out of time. I want to close off by really taking us to an issue that is very dear to me, which is around equity. And there's a specific question relating to how smoking affects the lower socioeconomic status groups. And by introducing these measures, will we encourage their involvement in illicit trade and put them in and make this vulnerable population even more vulnerable? So Robert, Chani, in your own countries, how are you thinking about this, and what safeguards are there to make sure that the vulnerable are not in an even worse state?
Well, that's a very critically important question, Jeremy. And in the broader context in New Zealand, the health service, the health system is being reorganized with a newly created independent Maori Health Authority to particularly address inequalities in health experienced by Indigenous people Maori. So it's on the agenda. There is always the danger that criminalization of any behavior will particularly affect the most disadvantaged, as we might see with the smoke-free cars legislation passed a couple of years ago. It is likely that people who are stopped and apprehended for smoking will be poorest people. So there's huge risks in these policies, but I think they can be managed. And I think we could deal with the illicit trade in cigarettes in New Zealand much better than we're doing at the moment. So huge issue.
Okay, thank you, Robert. And Shani, over to you.
Yeah, I agree that the lower income group will be disproportionately affected by any kind of enforcement measures. Again, it has to be tackled fairly. Even the cost of cessation treatment is actually a burden to these people. So again, the policy should be refined as to not to actually unfairly victimize the lower income groups. So we will be actually pushing for access to cessation treatments, and also enforcement should be fair in that basis. Yeah, thank you.
Thank you, gentlemen. We have come to the end of the session. If I can round out
very nicely some of the key points. One, I think that tobacco-free generation is an idea whose time has come in some countries, but not all across Asia. And in Singapore, there is optimism among some of the public health leaders and some of the pioneers that the time is coming. Secondly, we do recognize that tobacco-free generation is a tool, it's a powerful tool, but ultimately it's only one of a set of tools that are needed to address really smoking control effectively. Third point is that while we look at the youth as a vulnerable group, we mustn't forget the existing smoking population. We cannot abandon them, and some measures like what Keesing have put forward around bringing in vaping and other modalities of nicotine replacement on a prescription rather than as a consumer product. Ideas that we have to consider so that no one is left behind. And lastly, the policy intent may be very noble. The devil is in the details of the implementation, but that doesn't mean that just because it's difficult that it shouldn't be done, right? We can be clear-eyed and very clear-headed about the implementation and the practical challenges, but it should not deter us from doing the right thing. And on this note, ladies and gentlemen, thank you very much for this wonderful webinar, and thank you to all the participants, and we appreciate very much the flow of questions. It's been very, very useful to all of us. We will put this webinar onto the School of Public Health's website as our contribution to global health discussion and thought leadership. And once the link has been uploaded, we will share it with all the participants for you to further share with some of your colleagues. So thank you, everyone, and have a good day ahead.